Let's grab our anti-burst ball, placing it under your head, coming into a supine figure 4 stretch. Reach your tailbone away from you, creating low back extension. Dorsiflex the foot that's crossing over the knee. Use your elbow, the same elbow as the leg that's crossed over, to press that thigh open as you pull the hamstring towards you of the leg that's on the bottom. Continue to reach the tailbone away from you. And now connect with your breath. Inhale through the nose. Pull your belly button in towards your spine, bracing the abdominals. Exhale the air out the mouth. Again, keeping the tailbone reaching away, pressing the back ribs into the floor to keep the rib cage closed. Pull the navel in, brace the abs, and fog of air with your exhale. Go ahead and switch sides. We're opening up the outer hip, the glute med, piriformis area. Setting up, dorsiflex the foot. Use your elbow to leverage and open that thigh. Pull the hamstring towards you without lifting the pelvis up and rounding. Reach the tailbone towards the bottom of the mat. And now let's focus on contracting the transverse abdominis. To do this, we inhale through the nose, pull the navel in towards the spine, tug up on the muscles that stop your stream of pee, and hold that tug as you exhale the air out the mouth. Inhale through the nose, pull the belly button in, brace the abs as if you're going to be punched in the gut, and fog of air with that exhale. Contracting your transverse abdominis conditions the deepest layer of the core, and this can alleviate chronic back pain. From here, we're going to take the ball and we'll place it under the sacrum, elevating our pelvis. The ball needs to be high enough that when you place your pointer fingers on the bony protrusions of your hips, your ASIS, you can guide them down and the butt can drop off the roller a bit towards the floor, creating a lot of lumbar extension, and then we'll tilt the pelvis back to neutral and to extension. Every time the pelvis goes down towards extension, we exhale. Every time it comes back up to neutral, we inhale. Exhale down, inhale neutral. Moving only on the breath, lifting in and up on the muscles that stop your stream of pee, bracing the abs every time you take the pelvis to extension. And inhaling, resetting, breathing laterally into the rib cage. Pull the navel in, brace those abs, keep the back ribs imprinted on the floor, and tip down. Moving on your breath with the awareness of the core staying braced on the exhales, the sternum melting in towards the spine, the shoulders plug down the back, the collarbone wide. So if you notice yourself pushing your ribs forward, this is going to make it hard to access the core. So keep the ribs reaching towards the back body and the belly button pulling in towards the spine. One more breath here. Inhale, pull the abs in, brace them. Lift in and up on those muscles that stop your stream of pee, and fog a mirror with your exhale. Placing the hands right by your side, nice and heavy, palms down, wrists heavy. Float one leg up to butterfly. Keeping the other foot on the ground, the bone of the big toe heavy. We're going to lower and lift the leg, inhaling to lower, bracing the abs, exhaling to lift. Make sure you're not turning that leg out from the knee, but from the top of the hip socket, lowering and lifting on the breath. Remembering we always want to brace the abs to bring the leg back up and keep the tailbone reaching away so that we have some lumbar extension. Countering the typical position of the pelvis, which is flexion tucked under. Moving on the breath, give me 2 more. Inhale to lower, brace the abs. Hear your breath as you exhale to lift. 1 more, inhale, lower. Bracing the abs, fog a mirror with that exhale. And moving to the other side, setting up. Remember, the foot that's down, you should have weight in the bone of the big toe. There's a tendency to roll out on the foot. Supinating, bow-leggedness is what we see with sway back posture. We're going to balance the feet and ankles so that the legs are working efficiently. Should be lowering and lifting on the other side, trying to not wag the tail or move the pelvis too much. Just guide the tailbone away from you, keeping that lumbar extension. Guide the sternum in towards the spine, closing the front ribs, plugging the shoulders down the back. Check in with your breath. Inhaling through the nose, drawing the navel in towards the spine, lifting up on those muscles that stop your stream of pee, and fogging a mirror with your exhale. One last time, inhale, prepare. Brace the abs, and exhale to lift the leg back up. We're going to slowly bring both legs down, lifting the pelvis up to slide the ball out and place it between the knees. Opening the arms out to a T, imprinting them, making sure that the palms are up and the wrists are slightly below the shoulders. Nod your chin down, engaging the front of the neck muscles. Reach the tailbone away, creating lumbar extension. Exhale, float the legs up to tabletop. Knees should be tracking in line with the hips. Make sure that the knees are not slightly forward. This is going to make the work easier on the abs. We want to really work the lower abs here. So we'll move on the breath, inhaling to twist, turning the head away from the knees as they drop to one side, bracing the abdominals, and exhale, lifting the legs back up to center. Reach the tailbone towards the bottom of the mat for the duration of the exhale, bracing the abs each time you lift the legs back to center. Check in with your rib cage. Try to keep the sternum melting in, the collarbone wide, the shoulders plugged down the back. Turn the head away. You'll get a nice neck stretch as you're working. Hear that exhale. It's important that we use our breath. Inhale to prepare, exhale on the effort. Remember that. Inhale to prepare, exhale on the effort. And why are we exhaling on the effort? We're exhaling on the effort because that's when we are pulling our navel in towards our spine and lifting up on the muscles that stop our stream of pee. These two actions, when you sustain them, contract the transverse abdominis. And as I said, that's the deepest layer of your core. Conditioning this area alleviates low back pain. Make sure that when your sternum reaches towards your back body, you don't round the front of the shoulders. So there's a fine line between puddling the heart in and allowing the shoulders to round inward. So you have to isolate. Move the sternum towards the back body, but still plug the shoulders down the back and keep the collarbone wide. From here, we're going to take the ball and set it to the side, and we'll grab our foam roller, moving it under our upper shoulder blades, supporting our head. Our feet are hip distance apart, on the ground with the knees pointing up to the ceiling. We're going to take a rectus abdominis stretch, opening up the upper fibers of the top abs and internal obliques where you're tight. So we'll let gravity do the work as we slowly extend the upper back, supporting the head at all times, trying to open the elbows out and keep the shoulders pressed down and not elevating towards the ears. Inhale here, pull the abs in, brace them, and exhale that air out, sinking deeper into this upper back extension. Inhale, pull the abs in, brace them, exhale, allowing yourself to stretch further. So gravity does the work here. Some checkpoints to think about are the feet that are on the ground. Where is the pressure? Are you rolling out on the feet, or is there some pressure in the bones of the big toes? The tailbone. Is your pelvis tucked under, putting pressure on the low back? Or are you reaching the tailbone towards the feet, extending the lumbar to create more space? Obviously, since we're arching back, the ribs are going to spray forward. See if you can actually press your shoulder blades into the roller, trying to combat that. This is going to intensify the stretch of the upper abdominal wall. One more breath here. Inhale through the nose, draw the belly button in towards the spine, brace the abs, Fog a mirror with your exhale. Good work.